Okay, so my name is Shante Gagnon, and I am presenting on the effect of labor induction on unplanned cesarean delivery incidents. So for my PCOT question, I asked in women of childbearing age delivering in hospitals, what is the effect of term labor induction compared to term spontaneous onset of labor on the incidence of emergency cesarean delivery within 48 hours after induction or spontaneous onset of labor? So a few of the definitions: childbearing age was defined as being between 16 and 49 years old. Term labor was being 37 weeks or more of gestation. Induction of labor was using medical or other interventions to start the birthing process, uterine contraction, cervical dilation, and then effacement. And then spontaneous onset of labor was going into uterine contractions that caused cervical dilation and effacement without the use of medical interventions. And then we all know cesarean delivery is surgery, and you take the fetus out of the uterus. So those were the definitions. Background and significance. So one of the reasons why this is important: cesarean sections are actually the most commonly performed operation in operating rooms in the United States. And this rate has increased from 5.8% in 1970 to 32.3% in 2008. So it's increasing. And the reason why this is important, first of all, it is a safety issue. So cesarean sections put women at increased risk of infection, hemorrhage, abdominal and uterine injuries, and scar tissue buildup, as well as the need for additional pain medications such as opioids. And then it decreases maternal mobility, increases maternal mortality, and puts the infant at risk for breathing difficulties, distress, and even injury from the surgery. And then another reason why this is an important topic is because of the financial burden cesarean sections can have. They, on average in the United States, cost $2,000 to $4,000 more than vaginal deliveries do. So Alaska is the more expensive one, and their C-section costs $4,000 more than a vaginal delivery. And then Alabama is the cheapest state, where it costs $2,000 more than a vaginal delivery. So and that is just for the delivery alone, not even taking into account any additional expenses like more medication, increased length of stay. Obviously, it's a surgery, so you'll probably need to stay at the hospital for longer if you have a cesarean section. And this is a financial risk, but also can affect not only mom and baby, but any partners, maybe grandparents, or children who are waiting to welcome their new sibling into the home. It can be very stressful. And then lastly, post-traumatic stress disorder. So research has shown that if you are planning to have a vaginal delivery and you're ready for that, and all of a sudden you're being whisked away into a operating room and having a major abdominal surgery, that can cause some psychological and physical trauma. So findings. So my 6 articles, the authors are over here. The first one was a randomized control trial. All of the rest were retrospective cohort studies. And I think this is because ethically, it's just a lot easier to observe things from pregnant women. The randomized control trial was very safe, and it was graded. It gave it a level of evidence to be grading. They found that induction of labor does not affect cesarean section incidence. So it really didn't make a difference in their study. The second study, graded 4A, found that induction of labor more than doubled cesarean incidence. The third one found the same thing, graded 4A, found induction nearly doubles the risk of cesarean section. The fourth one, graded 4A, found induction actually decreases cesarean section incidence. So that was a little bit opposite. So kind of confusing, makes you kind of think about what maybe has caused this difference. And then the fifth one, graded 4A, found that induction of labor more than doubles cesarean section incidence. And the sixth one was graded 4B, but it found that induction of labor also increases cesarean incidence. They found it to a lesser extent, but still that it did increase the incidence of having an emergency C-section. So summary of the information. Most of the research points to induction of labor increases the risk for incidence of having a cesarean section. However, the randomized control trial found that it really didn't make a difference. The rates were pretty much the same in both groups of women. And then one of the observational cohort studies found that it actually decreases the risk of having a cesarean section if you're induced. So there are some contradicting results, could possibly be due to other factors like provider practices, method of induction, or even just favorable maternal factors that we have no control over. Some women just progress through labor with more difficulty than others do, so that could affect it as well. So recommendations for the future, based on this evidence, we need further research done. We really need research that could possibly narrow some of those other variables, like using the same provider for each woman in the group, or having the providers use the same method of induction at least, or the same monitoring systems, because those are things that maybe increase going in for a cesarean section, depending on what you're monitoring, how often you're monitoring. So doing further research that really uses the same provider practices to just kind of increase the internal validity of the study. And then also it would be good to do further research that looks at women with similar pregnancy histories, parodies, things like that, so that providers can make evidence-based decision based on their specific patient. Maybe induction of labor affects first-time mothers more than it does second or third-time mothers. Things like that would be great for clinical practice. But in the meantime, it looks like if providers want to decrease preventable cesarean sections, it might be a good idea to decrease induction of labor in women who have no medical need for it. And those are my references.